Welcome back, everyone. We're here with Dr. Stefano Chiaramonte, a nephrologist. Thank you for being with us, Doctor. So kind. Doctor, I think we should talk about something crucial, the harmful effects of smoking.
Coffee, then smoke?
Indeed, because we know that a lot of people, after having their coffee, definitely reach for a cigarette. By the way, there was recently a global day dedicated to raising awareness about smoking. It's not just Italy that has a high number of smokers, but various other parts of the world as well. If we had to rate smoking on a scale of 1 to 100, how detrimental would you say it is for our health?
I would say 300.
We have certainly exceeded our maximum threshold. Could you provide further clarification?
From 1 to 100, we consider 100 for the effect that smoke has on all chronic bronchopulmonary diseases, as it induces inflammation of the larynx and bronchi, making it an important cause of pulmonary inflammatory pathology. As we move from 1 to 100, still 100 for the possibility. In fact, smoke promotes tumor development, and we discussed neoplasms of the oral cavity, and particularly diseases of the bronchi and lungs, making this another top score. Then, moving on to score it on a scale from 1 to 100, I would say it is closer to 200. Let's increase the dosage once again. When it comes to the impact of smoking on the development of cardiovascular diseases, it is considered one of the leading causes of cardiovascular issues.
However, doctor, it is worth noting that while we frequently discuss smoking and diseases related to inflammation and tumors, specifically those impacting the respiratory system, we generally neglect to mention cardiovascular diseases. Can we delve into this aspect with you to discuss it further in relation to this matter?
Certainly, because attention is always focused on tumors, but in reality, smoking is a very significant risk factor. Why? Because smoking leads to an inflammatory condition, a widespread inflammation that subsequently leads to vascular damage, particularly in the microcirculation. The smoke still directly induces the combustion products of smoke, which cause microlesions on the endothelial cells of small vessels, and this is a factor that then triggers the formation of thrombi. Thus, smoking directly contributes to the induction of atherosclerosis, which affects both large and small blood vessels. Moreover, the smoke and combustion products from tobacco ultimately result in significant alterations to the cholesterol molecule structure. The accumulation of cholesterol, specifically the harmful type called LDL, in blood vessels is more likely to occur in the presence of microlesions. This initiates a series of events that ultimately leads to the development of plaque and atherosclerosis. Consequently, this highlights another critical consequence associated with the act of smoking. However, smoking can directly cause blood vessels, especially small ones, to constrict, which can contribute to the development or worsening of hypertension. This is one way in which smoking may induce or aggravate high blood pressure. The impact of smoking on the cardiovascular system is often overlooked, but it is significant. Consequently, cardiovascular disease emerges as the primary reason for hospitalizations and fatalities, making it imperative to address smoking-related health issues. Thus, smoking assumes an influential position, far from a trivial one, but rather a truly dominant one, always within the context of cardiovascular health. The smoke leads to inflammation even in the oral cavity, causing tartar formation, which in turn leads to periodontal diseases. These are inflammations of the gums and gum pockets that are often unrecognized, yet they are a source of inflammation that subsequently triggers and becomes a cardiovascular risk factor. Unfortunately, the incidence of senile dementia is increasing without fully understanding the exact reasons. However, it is well established that the condition has a vascular basis. In particular, smoking and the degradation products of tobacco are significant contributory factors leading to this vascular basis. Thus, you can see how smoke serves as a causal element for numerous significant health issues. Hence, On a scale from 1 to 100, it is worth 300, since 100 plus 100 plus 100 equals 300.
We really appreciate this thorough discussion. Doctor, could you help to debunk a common misconception? Many people question, oh no, smoking just 2 cigarettes a day couldn't do much harm, right? Is it harmful or not?
It hurts anyway. The famous little cigarette after coffee or after lunch is harmful anyway. It's clear that there's a correlation between the number of cigarettes and the effects, certainly, but we can't hide behind the justification that I smoke very little. The pack lasts me a week. It doesn't matter. Smoking exists. Additionally, another significant factor is how long the smoke lasts. Indeed, individuals who smoke for numerous years gather a host of problems, risk factors, and harm over time. Widespread, and therefore clearly the result. It's a genuine result. Poor, an outcome that is disappointing, which often causes very serious illnesses and often even death. And then there is the aspect of quitting smoking, which involves more than simply putting an end to the habit, as its effects can still linger. Unlike plants that regenerate in spring, the human body does not have the same ability to rejuvenate. Statistics demonstrate that after 6 months of completely and drastically stopping the act of smoking, the risk of mortality decreases. However, this risk persists for a prolonged period, and it takes many years for it to be lowered to an acceptable level, although it may still not be truly deemed acceptable.
Doctor, smoking is regarded by you experts as an independent risk factor that poses significant health concerns. What does it mean?
This implies that he alone can cause all this extensive damage. In cardiovascular disease, we are aware of multiple causes, which include well-established factors such as diabetes, high blood pressure, obesity, excessive weight, lack of physical activity, unhealthy eating habits, and smoking. Smoking alone is undoubtedly the main culprit when it comes to severe cardiovascular problems. However, its impact is not to be underestimated when it is combined with any of these risk factors, as it triples the negative effects. This makes smoking a powerful force, similar to a player charging onto the soccer field aggressively and with both feet. Recognizing just how much influence it has, statistics and reports consistently make a distinction between the smoking and non-smoking populations. This clear categorization underscores the undeniable significance of smoking as a primary contributor to this issue.
Sometimes being a source of aggravation is possible. For instance, there might be an increased risk for patients who suffer from both obesity and smoking. I envision that it could be an even greater danger to their well-being.
There are numerous risk factors that negatively impact the microcirculation, resulting in problems with various blood vessels. Notably, smoking exacerbates this harmful effect. Unfortunately, smoking has become a rampant issue, and the likelihood of significantly reducing it, even with advertising campaigns and initiatives, is slim. One concerning aspect is the increasing trend of students smoking in schools. This harmful habit is spreading like a plague. The challenge to address and prevent it seems insurmountable, and then smoking becomes a facet of liberation, of differentiation. It's akin to expressing rebellion, especially within the confines of a family, for instance. Thus, in this context, smoking assumes a prevailing role. Not just that, but regrettably, there are numerous subtle influences to be mindful of. Films where the protagonist smokes in one way or another. Videos, depictions even within magazines. And certainly, despite recent advertising campaigns targeting smoking reduction in television films, we still have a collection of vintage films, cult classics, starring characters with a cigar held in their mouth or a cigarette in hand. Iconic figures such as Humphrey Bogart and Clint Eastwood, just to mention a couple, effortlessly reign supreme over those we greatly admire. Therefore, it is quite challenging to dismantle that common belief. I wouldn't go so far as to call it a status symbol, but it's certainly not far off.
Regrettably, it appears that even when faced with the threat of substantial health hazards, people are not inclined to prioritize their well-being in such circumstances.
Without a doubt, every cigarette pack nowadays serves as a horrifying reminder, adorned with the most unsettling photographs. However, if you were to inquire whether a smoker has taken the time to peruse the warnings on the pack currently sitting in their pocket, the response is often in the negative. Have you examined the image? No. Consequently, the inclusion of these visuals serves little purpose in reality. Studies have proven that they are easily bypassed or disregarded, rendering it an incredibly unequal battle. On the other hand, Bacchus, tobacco, and Venus have included smoking among life's pleasures, because certainly nicotine is a stimulant. Nicotine is a pharmacologically active substance that has a stimulating effect on the brain. However, we compare it, we determine it as an addiction, so certainly nicotine is satisfying. It brings pleasure. A little cigarette after coffee or lunch is enjoyable, and it wouldn't be anything if it were just nicotine. The issue lies in the fact that the nicotine in tobacco smoke effectively conceals the presence of numerous poisonous, harmful, and highly dangerous substances in tobacco combustion products. These substances are responsible for causing damage and health problems. However, nicotine dispensers designed for those who wish to quit smoking offer the advantage of delivering only the active pharmacological component without distributing the harmful products. Now let us explore the realm of smoking cessation policies. I prefer to avoid venturing into potentially risky territory.
So, before we wrap things up here, I have one final question for you. Let's challenge another misconception. The notion that cigarettes or smoking actually have a relaxing effect. Instead, they actually stimulate you, causing an increase in both your heart rate, which I assume is immediate, and potentially other effects as well. I mean, many people say smoking helps them relax, but is that really true?
This particular effect of nicotine is observed at the central level. It is also associated with behaviors, gestures, and specific times of day. Hence, there are moments when nicotine indeed provides pleasure and relaxation. The practice of having a cigarette after coffee is not a recent invention. It has been around since ancient times. However, there is much more to this ritual than meets the eye. The idea of a cigarette after coffee is just the beginning, with a wealth of experiences lying beneath the surface.
Thank you, Doctor. We appreciate it. You've been very gracious.